Good morning, good afternoon, good evening, and thank you for coming to today's Grand Bargain Cash Workstream subgroup on linking humanitarian cash and social protection webinar. My name is Lois Austin, and I work with the subgroup, and I will be moderating today's webinar, during which we're going to draw on the knowledge of our panel of expert speakers as we look at transitioning from humanitarian cash to social protection in protracted crises, focusing on the case of Iraq. We're going to start the webinar today with our usual poll to try and give us an idea of who's participating. And this will help our speakers to know how to tailor some of their comments and their interventions, particularly when responding to questions. So please select now if you're a social protection actor, a humanitarian actor, both of these, or neither of these. And we'll just run this for 1 or 2 more seconds before I start a countdown to closure from 3, 2, 1. So just trying to see what the split is. So the majority of participants today, some 50% actually, are humanitarian actors, with 23% being social protection and 19% seeing yourselves as fitting into both of those categories, and 8% covering neither of those categories. So we will bear that in mind as we go through the webinar. Thank you. Just to give a little bit of background before we get into the substance of today's discussion, this subgroup is co-led by UNICEF, the IFRC and FCDO. Part of the work of the subgroup is to reinforce dialogue and knowledge sharing between humanitarian and development stakeholders to support the linking of humanitarian cash and social protection in times of crisis. This area of work, the knowledge management aspect, is led and funded by UNICEF. Today's webinar is the 18th in a series of webinars put together by the subgroup, and the first one was held in December 2019. To date, the webinars have provided the opportunity to hear from a number of experts representing different groups and bodies who've assisted in contributing to learning and knowledge sharing on many different aspects of linking humanitarian cash and social protection. The webinars have really helped to enhance our knowledge on what works and where we might come across challenges by listening to practitioners from numerous countries across the world, helping us to better understand where opportunities and blockages lie in linking humanitarian cash and social protection. In today's webinar, we're going to hear from humanitarian cash and social protection experts on the technical work that needs to be undertaken when identifying and developing approaches to transitioning from humanitarian cash to government social protection programs. Led by the Cash and Livelihoods Consortium for Iraq, the CLCI, which is comprised of the Danish Refugee Council, the Norwegian Refugee Council, the International Rescue Committee, Oxfam, and Mercy Corps, which is the lead, and in partnership with the World Bank, the Iraqi Ministry of Labour and Social Affairs, and financially supported by FCDO. The experts will present the technical work that's been undertaken to date, including analysing the overlap between government social protection targeting and humanitarian cash targeting, as well as the processes and preconditions for integration. We'll also hear about some of the challenges that have been faced along the way. And I think actually this is the first time that we've had a focus on Iraq throughout the whole series of webinars that we've done since December 2019. Following the expert presentations, there will be the opportunity for you to ask the panel questions. So please send us your questions into the Q&A box that you'll see on your screens, and we will try to respond to as many of those as we can before the webinar ends. Please do mention who your question is for if you'd like to direct it specifically to one of our speakers, and if possible, your name and the name of the organisation that you represent. We'll do our best to provide any follow-up to questions that we don't manage to cover after the webinar, and that will be put up on the socialprotection.org website. So before handing over, I will just give a brief introduction to our panel of 3 experts. Firstly, we have Virginia Leap, who is the Research Policy and Advocacy Coordinator for the Cash and Livelihoods Consortium for Iraq. As I mentioned, the CLCI is a partnership of 5 of the largest INGOs in Iraq, and it's been implementing cash and livelihoods assistance at scale since 2015. Virginia's been focusing on policy change in fragile states for the last 6 years. We also have with us Matthew Waipori, who is a lead economist with the World Bank and has worked on East Asia, the Pacific, and the Middle East on poverty, inequality, and their determinants, the middle class and top incomes, gender, forced displacement, and climate change. Matt is also the global lead for the distributional impacts of fiscal and social policies. And we also have Lakendra Federa, also with the World Bank as an economist in the Poverty and Equity Global Practice in Middle East and North Africa region. Lockie's work focuses on building the evidence base to understand the drivers of poverty and household well-being in fragile and conflict environments. His current research broadly focuses on the topics of poverty dynamics, household resilience, rural labour market, and the long-term consequences of conflict. So I will now hand over to Virginia, who will describe a bit for us the policy process of this collaboration between the humanitarian cash community, the World Bank, and the government of Iraq. So over to you, Virginia.
Thanks, Lois. Okay. I'm delighted to be here today to discuss the process that was undertaken by this partnership of diverse stakeholders, as Lois said. I'll walk through the timeline of a few key steps along the pathway to transition, and then I'll explain the key pillars we've identified as being critical to its success and share some broad lessons learned for others trying to do the same. So in 2014, a new social security law was passed. The Iraq Social Protection Network provides a range of benefits for households and individuals, including non-contributory food assistance through the public distribution system known as the PDS, health subsidies for women, cash and in-kind assistance to displaced households, pensions for the retired, assistance to families of military personnel, and then there's the SSN, the Social Safety Net. This is a program that's housed in the Ministry of Labour and Social Affairs, MOLSA, that provides unconditional cash transfers targeted at poor households. The program had been using categorical targeting until 2014, when the Social Security law was passed to shift the targeting system to a proxy means test. A proxy means test uses household characteristics to predict household poverty or vulnerability in the absence of reliable and accessible financial information, such as tax returns or payslips. In 2015, two key multi-purpose cash assistance, MPCA, coordination bodies were formed: the Cash and Livelihoods Consortium for Iraq, CLCI, and the Cash Working Group, CWG, which led to greater harmonization, quality, and scale of MPCA. I'll speak more about this in a moment. In 2017, there was a harmonization of the targeting method for MPCA in Iraq. The first PMT-based targeting method, based on programmatic data from the CLCI, was adopted, constituting a step towards harmonization with the government's SSN system, and was harmonized across all CWG actors. Later, in 2019, an updated PMT model was developed using nationwide multi-cluster needs assessment data. This model had three elements that aligned it further with the social safety net. First, its use of the PMT method. Second, its use of regional models, so Kurdistan region of Iraq, North and Center South. And thirdly, its use of consumption as the indicator of vulnerability. In 2018, there was a joint multi-stakeholder workshop. So in 2018, MPCA actors had reached nearly 200,000 households. And while it was assumed that, of course, not all MPCA beneficiaries would qualify for the SSN, the size of the potentially eligible humanitarian caseload in territory in the north, where the government's reach was restricted, was significant enough to warrant a careful examination of what types of referrals to government-led social protection might be possible. So this launched a policy-level discussion between the World Bank and the humanitarian community about their respective mandates in this area and their associated cash transfer programs. These policy discussions built momentum during a 2-day workshop on MPCA and social protection network linkages, which was convened by the FCDO, UNHCR and the World Bank, and attended by key stakeholders across technical and policy roles from MOLSA, the World Bank, CLCI, CWG, and key UN agencies and donors. During this workshop, it was acknowledged that among Iraq's many SPN services that I mentioned previously, the MOLSA SSN was the program best placed to meet basic needs of the poorest subset of households drawn from the humanitarian community's areas of intervention. The World Bank presented the PMT targeting system used for the SSN, and the CLCI presented the PMT targeting system used by MPCA actors, allowing for a basic initial overlap analysis. Later in 2018, following the workshop, the relevant technical staff from World Bank, CLCI, and CWG collaborated through the development of a pseudo proxy means test, what we call a PPMT. In 2020, following favorable results from the PPMT, the CLCI and the World Bank collaborated on conducting a field test. My colleague Loki will go into more detail on both of these exercises shortly. The 4 pillars that we've identified as being key to the success of this collaboration are scale, harmonized programming, convening power, and donor support. So the first 2 of these, scale and harmonization of MPCA, were critical. First, there was the formation of the CASH working group with the explicit support of the humanitarian country team, the humanitarian coordinator, its establishment as a semi-cluster to coordinate this growing use of MPCA, and it was given a seat at the ICCG. There was the formation of the Cash and Livelihoods Consortium for Iraq, then known as the CCI, which leveraged its pooling of the technical expertise of 5 of the largest implementing international organizations and its dedicated research resources to improve the efficiency, the geographic reach, and the effectiveness of MPCA. The consortium was formed with the express purpose of enhancing the impact of MPCA by designing and mandating a harmonized approach across its members. Combined, these help the humanitarian community overcome the conventional challenges of turnover and limited project cycles. Then there was sector-wide harmonized program design for transfer values and for the targeting system. All MPCA actors used a CWG-endorsed harmonized transfer value derived from the Survival Minimum Expenditure Basket, the SMEB, and a shared targeting model based on a proxy means test, allowing the humanitarian cash community to become a cohesive group that could emulate a makeshift safety net in its own right. And then there was early stage institutionalized commitment to transition. So from the start of the establishment of the CLCI in 2015, there was a strategic commitment to linking to the SSN and more broadly to conducting research and advocacy as a core part of its approach. There was also a strategic commitment to transition adopted by the CWG in 2017. And it was this commitment to transition from this early stage in the process that drove a number of strategic decisions around design of the programming that then allowed for this type of collaboration to occur. The third pillar is the convening power. So the World Bank, as a multilateral intermediary and as the convening power in this case, had the mandate and the relationships to secure MOLSA's initial engagement, as well as, of course, the expertise in establishing and reforming poverty reduction programs and social protection systems globally that ensured this technical expertise was present throughout. The World Bank recognized the social safety net reform process could benefit from the humanitarian community's experience with communication, accountability mechanisms, monitoring, and evaluation. The fourth pillar is donor support. So there was a supportive donor in FCDO who had the requisite engagement with both social protection and MPCA programming partners to understand and identify these areas of collaboration. FCDO used its convening power and its funding streams to organize the initial workshop and bring together a broader range of stakeholders. Their personnel had sufficient time available to prioritize this workshop and coordinate the subsequent action plan. It was also FCDO's flexible and long-term funding needed for this type of collaboration with atypical risks, including a change in government during the exercise and the involvement of multiple stakeholders with different mandates, and rates of staff turnover. So to summarize, the lessons that we've learned from this collaboration are first, that collaboration, harmonization of MPCA and a robust targeting system are foundational. It's important to establish strong coordination mechanisms such as CWG and CLCI and prioritize the harmonization of robust targeting early on. Secondly, it's impossible to do without funding that's of quality, allowing necessary flexibility and at scale. This is what allowed us to have this multi-partner, multi-year government-facing collaboration. Thirdly, it is important to involve a mediator who has the necessary technical expertise and a long-lasting established relationship with government, and ensure that the technical capacity of the humanitarian cash actors who need to engage with the World Bank team is there. Fourthly, special attention needs to be paid to the duty of care and due diligence of data protection and policy and practice. So the standards held by all relevant stakeholders must be made clear at the outset of the exercise to make sure that it can be conducted safely and ethically, and that necessary measures to ensure data protection and privacy are taken early on. In practice, the PPMT, the pseudo proxy means test model itself overcame this, as the coefficients and formulas could be shared with the humanitarian technical team, who would then apply it to their own household data. Then it is difficult to accomplish this without a mature social protection system in place. So each country has a social protection system that has a certain level of maturity. So it's important as a very first step to analyze the maturity of the social protection system. Within the spectrum of maturity, the Iraqi SPN can be considered as category 4 of 6, state-led commitment, which means that there was a commitment to expand social protection with some flagship initiatives for the poor, co-funded by the state. This was sufficient to be able to do this type of collaboration. And then finally, apologies, this is not on the slide, but I think another important lesson is that there are pathways to conceptual differences. So program eligibility between reducing poverty and meeting basic needs can be and usually are different. For example, on poverty reduction side, asset ownership is a common indicator for longer term poverty reduction, whereas for humanitarians, we tend to focus on vulnerability and therefore short-term behaviors such as negative coping strategies. In Iraq, humanitarians did not collect data on assets, in part because the staff have different mandates in terms of being able to enter premises and visually check. But instead, coping strategy usage did prove to be a good predictor of consumption. So the paper from alignment to integration that has been shared with you or will be shared soon groups together and expands on these lessons into those for humanitarians, those for development agencies, and those for donors. So I'll pass the mic back to Lois now to introduce the next section of today's session.
Thank you very much, Virginia, and really interesting to see across that relatively long timeline, maybe it's not so long given what needs to be achieved, of all the different steps and stages that have been traveled through so far. And also, I mean, some of the issues around the different areas of need for alignment and cooperation, so policy, operational and coordination, which are things that we've been discussing over the last couple of years in the subgroup meeting. So it's you know, sort of reassuring in a sense to see actually that on a practical, on the ground level that this resonates. So I think now we'll hand over to Loki, who is going to explain a little bit more in detail some of the innovative technical work that's been taken between the CLCI and the World Bank to improve the understanding of this transition. Over to you, Loki.
Thanks a lot, Lois. Good morning, good afternoon, good evening, everyone. Thank you very much for joining. As you just heard from our colleague, Virginia, there's a lot of work that went in before the technical work started. So the main objective of the technical work was to sort of assess how similar the humanitarian and the MOLSAS, that's the government's social cash transfer program targeting mechanisms were. The one of the good sort of piece of finding that came through the initial workshop was that both of these approaches use some form of proxy means test. But however, there was significant difference in terms of how these models were. For instance, the VM or the vulnerability model that was used at that time for the humanitarian assistance did not use per capita consumption as the target, which is the main welfare variable for the MOLSA's cash transfer program. But however, at the time, the humanitarian assistant, as my colleague Virginia mentioned, were updating the model. The new model called the socioeconomic vulnerability assessment tool used the consumption as the target. And in terms of proxies themselves, there were significant differences, as one would expect. The humanitarian models mostly relied on vulnerability indicators, whereas the government's cash transfer targeting formula mostly relied on asset and housing type. So the indicators that would be highly correlated with the monetary poverty. So with that, the proposed work plan was to sort of use some sort of statistical model to sort of calculate the or assess how these two scoring mechanisms overlap, to sort of assess the percentage of the humanitarian beneficiaries that would be eligible for the government SSN program. Next slide, please. Thank you. So with that, we constructed something called pseudo PMT or pseudo proxy means test. Unlike the normal or the usual PMT, where you would select optimal set of covariates or the variables or the proxies that are highly correlated with the sort of welfare or well-being variables that use as a target. The PPMT just uses the overlapping variables between the MOLSA's targeting formula and the formula for humanitarian assistance. So here is an example. So if the full PMT for the MOLSA used these 4 variables as the proxies, and then 2 of these variables were also present in the humanitarian targeting models, in this case year of education and good housing, then the PPMT would just rely on those 2 proxies. And then in this example, this particular household with 8 years of education, with good housing, not clean water, but with good toilet, would have a full PMT score of 0.97. But the same household would have a score of PPMT score of 1. So there are 2 ways of going about calculating the weights about PPMT. One would be just to use the same weights that the full PMT uses, or in that case, the score between full PMT and PPMT would be are comparable. The other way would be, once you identify the overlapping variables or the proxies, then recalibrate the weights. In that case, that's what is done here, and then also that's what we do in the paper. So in that case, these scores are not comparable, directly comparable. Next slide. So to continue with the example, so let's assume that the eligibility for the MOLSA's program under the full PMT is 1.05. That means households with the full PMT score of 1.05 or less would be eligible for the government's program. So that means out of these 3 households here, 2 would be eligible, one on the left with the full PMT score of 0.97, and then one on the extreme right with the score of 1.02. So as we discussed on the earlier slide, the PPMT does not use full set of variables, right? So that means it won't be able to sort of fully assess the eligibility into the MOLSA's program using full PMT. But what we can do is once we sort of calculate this PPMT score, and then we can calculate the probability or the chances of being eligible for the MULSAS program under the full PMT. So in this example, let's assume that all these 3 households have the same PPMT score of 1. So since 2 out of these 3 households qualify, so that means a household or the beneficiary with the PPMT score of 1 has a chance of qualifying for the MULSAS program is 67%. So in practice, these probabilities are used as sort of at the target or the referral targeting, or what we call the referral confidence. So that means this sort of allows flexibility for the government or the policymaker to sort of choose, depending on the budget, to sort of gradually implement this type of programs. So they can start with sort of targeting those with the high percentage of eligibility. So that means, let's say 90% or more likely chance of being eligible. And then once the budget is available, they can sort of decrease that referral confidence. Next slide, please. So based on that, we created 2 sets of PPMT models. As my colleague Virginia explained, that these models are region-specific, and also the government uses region-specific models. So one we developed for the VM model. So that's the targeting model that was used in 2018 or prior for humanitarian assistance. And then the new one was called the CEVAT, or the model using the MCNA survey that was just developed and would be applied to the future beneficiaries. So we applied this VM PPMT model in the legacy database under different scenarios to provide flexibility in terms of how this could be implemented. So here we have just presented 2 programs. So we have one program where the government is just targeting the households just below the poverty line, and then more ambitious program where the government would sort of target bottom 35% nationally. And then for each program, we sort of assess the humanitarian beneficiaries' likeliness of being referred. So 24% of the households in the legacy database would be referred would be eligible for the referral with 90% confidence interval. So when you decrease the sort of confidence interval to 50%, then 54% of those would be eligible for the referral. And under the more sort of ambitious program, then the referral rates sort of vary between 40 to 73%. Now, if we just sort of focus on these 24% of the households that would be eligible under this high confidence level, then some of the key characteristics of this sort of overlapping sample is that they tend to mostly reside in urban areas. They tend to have larger households, and then tend to have household heads with chronic illness and disability, and also and household head with lower level of educational achievements. So that was the one set of results. The second set of results are sort of looking at the applying the newer model that was developed at that time called CEVAT. Unfortunately, we didn't have the database to actually implement or apply the model to the database itself. But what we did was we sort of applied to the MCNA survey itself. So that's why we can assess the likely eligibility of the future humanitarian beneficiaries. So, under this new model, about 14% of the households in that survey would have qualified as extremely vulnerable and qualified for humanitarian assistance for 3 times a year. So when we are looking at this 14%, then these referral rates sort of vary between 1 to 13% when the government program is only targeting those below the poverty line, and sort of increases to 3 to 20% when when under the more sort of ambitious or larger programs that's targeting bottom 35%. So the important thing to sort of keep in mind here is that these sort of the second set of results are coming from applying to the survey data, not actually from the database. And there is a significant difference between the survey methodology and also the population on which these surveys are conducted, between the MCNA and also the National Household Survey that is called SWIFT, that was used to devise the government's or the MOLSA's targeting formula. And also we see significant difference in actual overlapping variables between those two surveys. And all these analysis is sort of is limited to the North region. That's the region where the CLCI's city program operates. These are the governorates with conflict, are the conflict affected governorates. So these, especially from these, from the legacy database, we see a significant referral rates. But however, all these estimates come from probabilistic models, right? These are probabilistic estimates. And we don't know if these results would hold in the field when with all the variables are available. And then second things to sort of consider is just classifying IDP household or a household as eligible doesn't mean that the household would actually be willing to be referred to the government's program. There could be some different reason, potential fear of discrimination, persecution, or some other reservation. So due to these, to reconfirm these or to confirm these probabilistic estimates and to sort of assess the willingness of the IDP household, a field review was proposed. Next slide. Thank you. So as part of the MPCA vulnerability assessment and recertification process, in 2020, late 2020, more than 10,000 of the households were asked complete set of questions that would allow to sort of create full set of MOLSA variables and also the humanitarian variables that are used in the humanitarian targeting formula. So that means we can assess the overlap with certainty, without any uncertainty or without using any probability. And in terms of the light survey or the field test, it sort of mirror how the CLCI's city program operates. And the coverage mostly sort of came from three governorates, mostly from Nineveh, Anbar, and Saladin. And in terms of household composition, more than 25%, or 20 to be accurate, 28% of those households are female-headed. More than 50% live in rural areas, and about 14% of the household have have the household head with disability. And more than 80% of the sample are recent returnees, 13% are IDPs, and about 6% are host or those who didn't displace or remainees. In terms of referral, 65% of the sample or the household in the sample had registered for some form of government assistance. Mostly they are registered for PDS, Public Distribution System. That's supposed to be universal. And 30% also had registered for MINGA program. So this is a one-time cash transfer program that was done by the government during COVID-19. And most sort of striking or important results here, I think, is that only 67% of these households were willing to be referred to the SSN, the government SSN program. So in terms of referral and non-referral and the overlap accuracy, we are almost there in terms of analyzing. We're in the final stage, so we could not present today. But I think one of the sort of key takeaway from these early results from the field test is that a significant number of these households are not willing to be referred to the SSN program. And when you look at the characteristics, right, those at least the observable characteristics between those who would be willing and not willing to be referred, we don't see much differences in that. So with that, over to you, Lois.
Thank you so much, Loki, for really digging a bit deeper into some of the technical work that's been undertaken and where you've reached so far with that, particularly explaining the approach taken to categorization and the pseudo PMT. I think in the interest of time, I'll just go straight to Matt, please, who will give a bit of an explanation as to how the findings from this work can be applied and considerations for policymakers and humanitarians working in social protection. So over to you, Matt.
Thanks, Lois. So just before we open up to discussion, I'd like to say a couple of words on what do we make of all of this, both as for policymakers, humanitarians, and then how might this potentially be applied in other contexts. So if we take a step back to what is the bigger picture here, you may find as a government that you have an existing social protection system, but you're looking to expand it to areas where you haven't been before. Maybe you don't have an existing social registry. Maybe you don't have the budget to collect new data. Maybe you can't go to certain areas due to insecurity, but these areas where maybe humanitarians can. So in the context of Iraq, they had an existing cash transfer program and targeting system, but were not obviously active in the ISIS-occupied areas. And once those were liberated, the government was interested in expanding, but didn't have any information on who might potentially be beneficiaries there. So they had a couple of options. One was they could go in and conduct a full data collection, a new data collection in these areas, which would allow them to collect all of the variables for their targeting system. But this is obviously quite costly. On the other hand, there is the existing humanitarian database where they had been active in these areas, which didn't include all of the variables for the government's targeting system, but it would not cost to collect new data. The trade-off here is cost versus the accuracy or the certainty about the eligibility of the humanitarian caseload. So why does that uncertainty matter? And this matters, I think, both to policymakers and humanitarians as to whether or not it's a good idea to use the humanitarian database, at least initially, to build out the social protection system in these areas that have previously been occupied. So uncertain eligibility has two consequences. The first is you may estimate that a humanitarian beneficiary would be eligible for the public program, but it turns out when you do the full assessment, which is not available from the humanitarian data, that some of the households turn out to be ineligible. This is a problem because by referring them, you're raising expectations that they will in fact qualify for the public support. And then of course they could be disappointed. And particularly where you've had civil conflict in the case of IDPs in Iraq, this could lead to not only disappointment, but additional tensions. And this is not just a consideration for the policymakers, it's a consideration for humanitarians. If you think only half of your beneficiary caseload is going to be successfully referred, do you want to release your data? Do you want to put your beneficiaries through the process of assessment where maybe 1 and 2 may be rejected? So I think this is a consideration for both policymakers and humanitarians, and it's a subjective a decision as to what type of success rate on the referral count enough. Do you need 90%? Do you need 70%? Do you need 50%? At what point is this trade-off worthwhile? And a second and related question to that is there's a trade-off between the number of absolute new beneficiaries will enter the government program and this referral success rate. So in the field test, which as Loki said, we'll have results on very shortly, we start off by testing the most vulnerable humanitarian beneficiaries, those classified as extremely vulnerable. And we found that they had a relatively high success rate on referral. So if you begin by referring those, a good portion of those will be eligible. Now, as you move to the still humanitarian beneficiaries, but say those that are considered moderately vulnerable or just vulnerable, the success rates will fall because there is the overlap between the targeting systems. So of the moderately vulnerable humanitarian beneficiaries, a fewer percentage of them will be eligible for the government program. Nonetheless, in absolute terms, by referring the moderate ones, you'll get more total people of the humanitarian caseload who qualify for the government programs. So again, you have a trade-off here between having the most possible people who are eligible enter the government system versus declining success rates and therefore more raised expectations and more disappointment. So this is another consideration, I think, for policymakers and humanitarians. Do we use this at all? And how high up our vulnerability scale do we go in our referrals? Next slide. So finally, I'd like to sort of think through just a couple of questions about, this was done in the Iraq context. What might you think about if you're trying to apply this elsewhere? So the first question is, do these conditions for successful collaboration exist? And these are the sort of criteria that Virginia went over earlier in the discussion. Do you have a sort of consolidated humanitarian approach? Is it at scale? Does it have a common targeting system? Is there an existing public safety net that you can look to align to? Do you understand how that targeting system works? Then, the targeting does matter. In the case of Iraq, the government was using proxy means testing for targeting. The humanitarians were also using proxy means testing for targeting. And the PMT they used collected a subset of the data required for PMT. Now, I know there have been a number of questions in the chat box about the limitations of proxy means testing, PMT, and certainly it does have its limitations. The focus of today's discussion is if the government is using this system, PMT for targeting, and if the humanitarians are, we're showing a technical method that would allow you to determine to what extent do they align and to what extent might referrals be successful. But there are a range of bigger questions, certainly when it comes to PMT, that we haven't focused on. Second, the overlap of variables in the two PMT systems. Is it enough that you can create these pseudo PMT models, these probabilistic models that give you with some degree of certainty the likelihood of a referred humanitarian beneficiary being eligible for the public system? If you've only got two variables that overlap, for example, you probably can't develop these overlap models that give you some sort of confidence about referral or not. So even if both agencies are using PMT, it may not be enough to do what we did in Iraq. One question I think is important on the humanitarian side is, have you already conducted intake assessment? If you haven't, what can you learn about the existing government programs and the existing government targeting mechanism? And as you do the intake assessment, can you collect information that's not just information for the humanitarian vulnerability assessment and assessing eligibility for humanitarian support? Can you collect some information that would be relevant to the government eligibility criteria, which means in the future, you may be able to do this sort of referral process, or at a minimum, calculate what percentage of the humanitarian beneficiary might be eligible, what might be the overlap. So even if names or referrals are not made, there's information for the government in terms of what the likely overlap might be, what the likely amount of eligible beneficiaries in an area they have not entered might be for budgeting and planning purposes. That alone, I think, has value. And then finally, how might this change if we're talking about refugees instead of IDPs? And these are very different contexts, although technically the methods may not be that dissimilar. So with IDPs, obviously the state in theory has an obligation to its citizens, and the IDPs have rights to the public support programs that they've been excluded from due to the conflict. When it comes to refugees, this can be quite a different situation. In some areas, for example, in the Kurdistan region of Iraq, refugees have very much the same rights and eligibility as as citizens do in other parts of Iraq and in other countries, refugees, may not have those same sorts of rights. So the legal situation is very, very different. But I think even on a technical basis, the assessment of refugees could be different than the assessment of IDPs. To begin with, I think there are different data privacy and security considerations. And sometimes the assessment for refugees may focus more on softer measures of vulnerability rather than some of the harder measures of economic deprivation that sometimes the public support systems use in their targeting. So I think when you're doing refugees, this technical approach potentially is applicable, but I think a number of other considerations come into it. So with that, I'll turn it back to you, Lois, and look forward to the discussion.
Thanks very much, Matt. And really, really interesting and important to learn actually how what's been applied in Iraq might be applicable or taken into other contexts, as well as understanding that some of the trade-offs that have to be taken into account when trying to harmonize and align systems. I'm going to ask all the panelists to put their cameras on, please. And we have 2 or 3 questions in the chat box. I have to say, the panel have already done an excellent job of answering the questions as they've been coming in. So thank you for that. I think the first one that we'll look at, which Virginia, I'm going to hand to you, is the question coming in from Luke about some of the issues surrounding, or the limitations surrounding PMT, particularly from a humanitarian perspective and taking into account the application of humanitarian principles, and how some of those risks are mitigated against or have been mitigated against. So I'll hand that one over to you. And Matt and Loki, if you just put your cameras on as well, and then if you want to add after Virginia's responded, and otherwise we'll move on to the next one. Thank you.
Thanks, Lois, and thanks, Luke, for this question. It's something that we discuss very frequently within my team. So there's 3 areas that I can speak to in terms of how we made this decision and subsequent research that we've done to try to amend our approach to mitigate some of the challenges you mentioned. So firstly, when we looked into the social cohesion effects of the PMT, or of the targeting system we're using, one of the major challenges was the opaque nature of the criteria, of course. And what we found was that by developing a standard communication script that's used in the same way by each of our partners at all levels, starting with every participant that's assessed, and then also used in interactions with the local authorities and the communities, this did manage to assuage some of the concerns of the participants about not understanding the criteria. So there was this standard script that we developed, and we noticed that that did reduce the number of complaints we were getting, and it did reduce the crowding at the distribution sites. Secondly, all models have errors. The PMT model is a model that allows you to quantify the errors quite easily. One of the errors that can happen by other types of systems, such as community-based systems and to a certain extent categorical targeting, is a bias against marginalized groups. So in Iraq specifically, the tribal differences, religious sectarian issues, and now especially ISIS affiliate families will often fall into an error category if you're to use a purely community-based system. And so we found that the PMT, as a relatively objective means of assessing households, managed to allow us to sidestep some of those issues. And then the last note I made was that when we looked at social cohesion impacts of MPCA, and targeting system was one of the big ones, we found that it only lasted as long as the assistance itself. And so our assistance is short-term in nature. We offer cash for up to 3 months. And what we found was that the effects were immediate with the targeting, but then they did subside. And so the short-term nature of the assistance as well minimizes the concerns about long-term disruptions to communities with the targeting system. Of course, if the assistance is longer term, such as livelihoods assistance, then you would want to ensure that there's a community-based targeting system. Some of our partners use HEA, household economy analysis, or the poverty wealth ranking method, and this ensures community engagement from the outset and ensures that these marginalized groups can be included, even if there are biases. I would say that a recommendation from my side would be to ensure that social cohesion analysis is being done alongside any use of any targeting system. And so to ensure that you're actively seeking out any social cohesion impacts of your assistance.
Great, thank you, Virginia. I mean, I think that was quite a comprehensive answer. I don't know, Matt or Loki, if you have anything to add, stick your hand in the air. If not, we'll move to, okay, Matt, do add and then we'll move on. Thank you.
Yeah, yes, very briefly. I mean, I don't think we want to get into what are better targeting methods or not. That's sort of outside the scope of what we're doing here. We're talking today about, you know, technical solutions to aligning the humanitarian and public safety nets where they are using PMT. Having said that, I'll just say two very quick things about PMT. We certainly don't think it's appropriate in all situations, and it comes with built-in errors. So, you know, acknowledge that. And I think one thing to note is PMT in particular is designed to pick up chronic poverty, and it might not be so good at picking up transitory poverty, which is exactly the situation that you have amongst IDPs in insecure parts of Iraq. So, you know, IDPs may not sort of fit the normal PMT type of evaluation. They may have lost all their assets, but still have education and skills and be able to get good livelihoods at the places they had fled to. On the other hand, they may still have their assets. It may have been a car, they may have piled everything up into it and driven to another area and been staying with relatives in a nice place. And it might look like they're okay under a PMT, and yet they're still quite in need. So certainly a PMT has its problems, and it does have its problems when you're looking at displacement and shock. And I think the key to this, and Virginia mentioned it, is, you know, having for any targeting mechanism is having a grievance redress mechanism, having an ability for people who feel they've been excluded unfairly to be able to apply, to be assessed and fairly evaluated, or for people who think someone is part of the system who should not meet to be able to make complaints. So, you know, the PMT is just part of a broader targeting system.
Okay. Thank you, Matt. There's a question from Ruby Khan asking about the role of the government, and obviously we haven't been able to get all stakeholders today at the webinar, but the type of capacity strengthening that's been provided to accompany the whole initiative. I don't know, maybe Matt or Lockie, would you like to answer that?
Matt, do you want to take that?
So this is on the capacity building side?
Yes, and just a little bit about the role of the government.
Yeah, so I mean, I think this is sort of a very Iraq-specific context. I don't know how well these lessons generalize to other locations. I mean, one of the lessons I think for us has been the issue with continuity throughout this whole process. As Virginia said at the introduction, we began this in 2018, sort of a joint workshop, which was MOLSA from the government, from the Ministry of Labour and Social Affairs. It was the various humanitarian actors, and it was the World Bank, convened by DFID as it was then, now FCDO. And since then, there have been a number of changes of government, a number of changes of leadership within MOLSA. And what that has meant is sort of, I think, perhaps the initial vision of where this work might go is not necessarily where it has ended up. So we've continued the technical work, we've continued to engage with the government, but it's become a little bit more fact-finding, what might work, what might not work. And now with, of course, the new elections just having happened and there being a process of determining, you know, what the new administration will be, I think what that means going forward is quite uncertain. Having said that, what we've found with capacity building is if you engage, despite the disruptions and the lack of continuity, the more you engage, the more you bring the government in. You know, those people will often move in and out of government, but to a certain extent in many countries, the elites are the elites, and there's a certain amount of rotation within the ministries, and they will stay involved. So the more you can build the capacity, often you'll find that capacity pops up in a different place. But we did start off with strong engagement with the government, but lack of continuity has made this quite a problem.
Thanks, Matt. The next question is from Diana Tunia, and it's based on the lessons learned from what you've been doing in Iraq and from this study, which I should just highlight. Do find the link to that in the chat box. Are there any other countries that come to mind where a similar approach could be adopted? I mean, bearing in mind, obviously, some of the unique nuances that we see in every country. Lockie, I'm going to hand over to you again, just in case you do. I mean, you or any of you, actually. Lockie, why don't you have a go? And if not, we can hand it over to Virginia, maybe.
I think many of the findings, or at least the exercise that we carried out, right, could be sort of could be lessons for places where with significant displaced population, with FCV sort of FCV context, where there is, as I think Virginia and had sort of outlined, sort of the success for this particular particular collaboration that we could carry it out, right? So if from, I don't know exactly which other contexts have those sort of fit that criteria, but any of the countries where you have sort of harmonized sort of mechanism for cash transfer among the humanitarian actors, and also sort of use some sort of like targeting formula, like the PMTs, and the government uses the similar type of targeting, then it could be used in those contexts, right? And in terms of exact or the example, sorry, I don't have in my mind. Maybe my colleagues might know better, or we're going to jump in.
So all I would add to that is Loki sort of outlined the technical criteria that you would need to extend this to other countries. I'd also say there's political criteria. I mean, I think there are different ones for refugees and IDPs, but they matter for both. So for example, you saw the unwillingness to be referred was at about a third in Iraq, right? Where people are perceived as potentially being ISIS sympathizers and therefore face persecution and discrimination, therefore don't want to be referred into it. So if you think of a country like Syria, IDPs, public programs, humanitarian caseloads, the technical criteria, may be filled in a certain sense, but you'd imagine that the unwillingness to be referred into the public programs there may be even higher than it is in Iraq. So I think there's a set of technical questions you might ask yourself, and there's a set of political questions you might ask yourself as to where this might work.
Thank you both. I think, we've got a couple of minutes left, and you'll see that the panel have been answering questions as they've come in, and that's in the chat box, and we will also try and share those afterwards on the socialprotection.org website for those of you that haven't had a chance to read them. But I think I'll just take this opportunity to thank you very much, Virginia from the CLCI, Matt and Loki from the World Bank, for taking the time to speak to us and share some of the experiences that you've had in Iraq, and that I know that the work is ongoing, but very much appreciated. I would just ask the audience to complete the feedback survey that will pop up hopefully on your browser just at the end of the webinar, and wish you all a very good day, afternoon or evening ahead. And please do keep an eye out on socialprotection.org for a summary of the webinar if you'd like to have a look at that and some of the questions and answers that have been responded to. But thank you all very much for joining us today. Take care.